ask Dr. Schoeneker to give one more talk. Let him finish up the day.
Yeah. So much. So this has been great today, and I set this up to be really directed at the Chiefs. This is a talk that I wish I had had right when I was finishing. And this is somewhat based off of one of my favorite authors, Jonathan Haidt's The Happiness Hypothesis, which is a book. And it is about two main things that you need to know about your life in terms of being happy. And that is finding a community that you have agency in. And for everybody in here, especially the Chiefs, it's actually easy when you go through medical school and residency to have that community because it's here. The agency, you have Joseph giving Alex crap nonstop, and that's Alex's agency is that he's the target for everybody. But the agency component to this is so important is that if you're going into this, you're a type A personality, you want to be important in something of what you're doing. And the part of going through this that happens that you're going to see as you guys go through in a couple of years on this is that Chicago in July is very meaningful to many people in this room. And that is when you actually become a board certified orthopedic surgeon. And for you guys, this is going to be 2 to 3 years from now. And I remember sitting in most residents think this is they look at the attendings and think, man, they have it easy. Is I'm doing all this work, doing all these things. Being an attending is an easy thing to do. And in actuality, being attending is more like this, which is from Moby Dick. It is one of my favorite parts of that book, which took me about 10 years to read. And there's this part where Ismail's sitting at a bar and he's staring at this picture and he's trying to describe it going on and on and on. And finally, what he says is, it's if the New England hag was trying to delineate chaos bewitched, is to show chaos under control. And for so many people in this room, we go at such a high gear that that's what our lives are like. And some days we win and some days we lose. And I know everybody's felt that part of it. And the goal of everything of this is to figure out who you are so that you can maximize what you do, but also to make it so most of the days you actually win. And most of this is to figure out the communities that you want to be in and have the agency within that community that you are important to that community. And again, going through medical school and residency, there's a component to it that's easy. The community is there for you. Your agency, you're told what to do. But then when you all of a sudden go out on your own, you just have this free fall of saying, okay, go work. And it's not easy to figure that part out. With that, as we talked about before, for the reasons that I said, is this was hands down the most important day of my life. Because the community that I have, as I talked about with my family and watching my kids grow up, has been absolutely incredible. And my agency within that community changing as I go has been so much fun for me. Is that when I have, your child's 3 years old, it's very different in terms of your agency as a parent as what they are at this point, telling my son, well, you should shave, but then just to make them feel better, I just, started growing it out too. But that part of it is so important to understand where you fit into that. But then you also look at the things we talked about of who I am as being a surgeon and a scientist in those communities and how much that means to me here, especially fostering that and that part of the community for me is so unbelievably important. And this aspect of taking residents and fellows through to learn how to do what we do has been such a big part of the community of who I am, that when you go back and you look at this in terms of the breakdown of my life, is that when you really break this down of what I do day in and day out, the majority of the community in terms of what I spend my time doing is work. and teaching and educating. And if you actually look at this, there's a part of this that at first makes you feel kind of sad about that. Is that the amount of time I put into all of this versus being with my family and my hobbies. And the thing that I've learned over time through this that's incredible with this community is that if you figure out who you are and you come home after delineating that chaos bewitched, and most of the days that you come home, it's positive. It's unbelievable how much your family sees that and appreciates that. Because when it boils down to this, our type A personalities, we're selfish. Is that we're selfish with time. Is that we're out doing everything that we possibly can to succeed at something, and it's at a cost regardless. And it's great that you're doing what you do because you need to come home every day and the first words out of your mouth are to apologize. Is I'm sorry that I'm selfish. And the thing is you're always going to be hunting for a reason to justify your selfishness, but you never want to have to completely answer that question. One of the hardest things in the world for me that I learned is that if I missed a soccer game, you don't want to look at your kid and say, and they say, I would love you to come to my soccer game, and have them feel bad for asking you, saying, no, I need to go pin an elbow. You don't ever want them to feel bad about that. At the same time, all of us have picked a profession that for the most part, it comes as close to justifying our selfishness as possible. I would prefer to be sitting here going and saying I had to miss a soccer game because I pinned an elbow as to saying I was out swindling somebody for a lot of money. And so you're never going to be completely satisfied with the community views established with your family of being able to justify every reason as to why you might not be home. But I can tell you that if you really figure out who you are, your family will see that what you are doing is as close to justifying that as possible. And that component to it really comes down to understanding how to avoid burnout. And in particular, what the new term is now is moral injury in terms of the things that we do. So that when you come home and you sit down with your family, you weren't just selfish on time, but you also didn't like what you did. That's when you're going to run into problems. And there's a component to this of building that community and agency of the things that you do that are so unbelievably important to make it so that you avoid that part of it, so that this delineate chaos bewitched is you win most of the time, so your family sees that. And what that boils down in terms of your overall wellness is that aspect of community and agency. And for most of us in that room, after you get your boards done, when you go into it, the main thing you're going to find community and agency and you should build on is your clinical practice. There's nothing better for me in terms of what I do as a pediatric orthopedic surgeon that I'm positive I'm making an effect on is taking fear away from parents. Is having kids and knowing that the biggest thing I'm afraid of is something happening to my child that I can't help them with. Is being a pediatric orthopedic surgeon is so pure. Is that I know the number one ICD code that I take care of is parental fear. Is that I can go and look at a parent who has a child whose hip is dislocated in their postpartum, and I know how unbelievably afraid they are that their child's never going to walk, and look at them in the eyes and say, I can help you with this. That'll never get old. And one of the main things for you guys is to understand that. Never lose the aspect that the main reason why you're a doctor is to take care of patients. Be an agent in that part and be really good day in and day out of saying what makes me happy about taking care of patients, and never lose that part. I adjusted my clinic schedule very intentionally because of that. Is that when we just kept 3% adding on how many patients I would see, it got to a point where I started feeling less satisfied about having agency with those families and being able to allow that mom to cry a little bit longer in the room instead of trying to rush out of the door because I'm behind. You have to take reins on this. You can't just be a passive person in this and let this happen. Figure out what part of that you like. Then think about the other aspects about community in terms of what you work in that you really enjoy. The parts we've already talked about for me in terms of education, I'll never get sick of it. I love seeing young people coming through with curiosity and integrity and helping them get somewhere. And that's my agency within it. Is that I know I'll always have a purpose for that. I know we'll always have guys, gals, et cetera, who come through that I can help them get there because I know how to get them there. And that part of it has been fun for me to see. This is when we went out and we were jumping off of a 100-foot, tower. You came over to me and said, I'm one of the luckiest people in the world. Is that I have somebody, Peter Waters, who's coming back here that I can just sit down with, and he still wants to have agency in this world and help out this program. It will never get old if you figure out who you are, what you're good at, and where you want to help. And the hardest part about this is to figure those things out. And I've got some parts of that. The next part is that for family and community, you must be intentional. You guys work so hard as you go through residency. You have very little time for doing other things. Make sure that you explore what other aspects outside of medicine are important to you. And as I said, for me, it's family is hands down number one. And then Susan and I have a community within Nashville. It can either be through volunteering, a church, et cetera, but establish yourself within that and intentionally make sure you have agency within it so that when you go outside of medicine, you have other things that you are doing. And then the other part is have your hobbies, have those things that you do that make it so that you can just shut your brain off and do other things. But what this boils down to in terms of the advice is you have to learn how to know yourself. You have to learn how to navigate through all of this to optimize these things for you. Develop the balance to make sure that you are intentional about engaging these other aspects outside of clinical practice of your family, your other communities, and your hobbies, and to be very dynamic, knowing that things are going to change. You never know when your child's going to get sick, when they're going to have problems, et cetera. You need to be available to make absolutely certain that you are willing to change where you're putting your time to allow for those communities to continue to succeed. We don't teach you how to do this. And the main advice I'd give you in terms of learning from it comes down to establishing mentor-mentee relationships to really figure it out. And what that boils down to is that you need to have mentors and you need to mentor in order to know yourself. Not just have it that you are having mentors, you have to mentor other people to figure out yourself. What you'll end up finding is that you learn so much from your mentors, but you actually learn more about yourself from mentoring other people because you have to think about what to tell them. And it makes you so reflect back upon yourself and what have I done wrong and right. If I want my mentees to be better than what I was at the same time, I have to be very introspective about that. So you establish this network that's incredible. And the part about it in terms of just an exercise that I truly believe everybody should do about every 6 months is this. The mentoring component to this really has 4 parts. And what that comes down to is that you have your mentor, your coach, your heroes, and your sponsors. Learning who these people are in your life and visiting with them intentionally at certain points is so important. The true Socrates mentor is a mirror. It is somebody that asks open-ended questions of you that allows you to explore who you are and what makes you happy. You don't want this to be somebody to tell you what makes you happy. This is somebody that you can just go sit down and just start talking, and they're really good, almost like a therapist, is getting you to come to that answer. So you have to learn somebody who can do that. Once you start figuring out who you are in an area of a community, that's when you can go to a coach who can tell you how to do something in that area and become better at it. You then want to have your heroes that you look at and say, when I'm 50 years old, that's what I want to be like. When I'm 70 years old, that's what I want to be like. And make sure that you start dissecting how they got there. You then want to have sponsors, and those are people who can help you actually get into those communities. For me, there's been so many of them in terms of getting into POSNA with the community, IPOS, et cetera. Those are the people who really help you do that. The most important thing to realize is this, where you'll be frustrated on it, is if you start grabbing mentors and you are asking the mentor to be something that they're not. An example I love to give about this is that Greg Mencio is one of my great mentors. I don't know if you guys all know him. He's a great guy, but I'll tell you is he is not, he is amazing at promoting, incredible. He is unbelievable at coaching. He is my hero. He is horrible at the true Socratic mentor. Greg is not the guy who's going to sit down and be like, Shed, let's just talk about yourself and where you're going. That's just not him. And when I first started off, I found myself frustrated with him and would come home and ask my wife, this guy's been my hero forever. Why am I frustrated? And what I realized is that I was expecting something from him that he's not. And when I figured that out and figured the other people who are truly my mentor, know myself part, who are willing to sit down and talk about that, I all of a sudden realized Greg was amazing. And that's because I go to him when I needed coaching, go to him when I needed sponsorship, and he always was my hero. And that's a part that you have to set up a grid for the things that you do in life. And you really need to fill this out. And you have to be unbelievably intentional about this. Is that you have to go through and decide who are the people that I use for each part of my life in order to make it so that I can optimize who I am. This is the part that we don't teach that I can tell you for me has been absolutely incredible. Because if I find myself at a part with education of like, I'm kind of frustrated in terms of where I'm navigating these waters right now, then I knew that I'm going to go and talk to my dad, my wife, Jim Castro I've talked to a ton, Ments on that in terms of education. Don Bay's been incredible. And before it was Neil Green. For my family, I have so many people. I love this one in terms of my hero. My family is my hero, but my dogs are also. But this is something you want to revisit to fill this out so that you can maximize who you are. And you need to make sure you fill it with people who have credibility, reliability, and value, which essentially boils down to me are my parents. And that is that they're indispensable in that they have always given me unconditional love, but I can also count on them of giving me tough love. They will tell me when I am wrong. And that is something that is really important in terms of your mentorship for all of these areas, is they don't just sit there and pass it like, yeah, that sounds good. You want people to say you're going down the wrong direction on this part of it. You want them to provide choices for you, encourage mistakes, and one of the biggest things now is that they show up. Is if you say, hey, I need to have some time to sit down, is that they actually will be there for you. You can count on them. So with that, what you'll find is as you start to establish that, you also realize that all of us are always bi-directional here. Is that I love that my dad, who is almost 83 on this, still has people he considers his mentors. And at the same time, as you do that, you start realizing I could actually be very good as a mentor to other people. You already do this in the residency program with the senior residents to the junior residents. And you want to find out what you are really good at in terms of these things. Some of you might not be good at being a mentor, but might be great at coaching. And figure that out about yourself so that when people come and ask you to be a mentor, you don't frustrate them by trying to fill the wrong role. And you can even identify that to them and say, hey, listen, I can really help coach you on this, but you might want to go talk to Joseph. He's much more touchy-feely and kind of like sit down and listen and ask open-ended questions. And you want to find that out about yourself so that you can have an agency within your community as a mentor to make it so that you can grow that community and be really important with it. And so overall, what my biggest advice is to the chiefs on this in terms of understanding all of this is make sure you start setting up these mentors now. One of the best reasons to why you guys came here is it's filled with some of the most incredible people that you can look at and say, I want to be like that when I'm 50. I want to be like that. It's filled with heroes. And I'll guarantee you 10 years from now, you can call any of them and have coaching at 1 a.m. Hey, I'm seeing this. What should I do with it? Those are the most valuable people in the world. And when you go through fellowship, make sure you really grab onto that. And then when you come back to this part of it, your main community that you will be in is going to be your family and your clinical practice. Develop those other areas, figure out who you are and establish that aspect of the community and have agency within those as you grow. That was my big intent in terms of building the lab. I love that we do research there, but the main reason I have that lab is the educational part in terms of the community and agency that I have within it. And it's something that as you guys figure out who you are, you can be very intentional to build this and make it so that you are really good at understanding that your wellness is completely comes down to that component of your community and agency, and just be active in it to figure all of that out. And I really think, as Jonathan Haidt said, is that happiness hypothesis is that it's not as hard as is what we make it to be. So congratulations on being done. You still do have a couple of hours to figure out whether or not Alex passed. We'll find that out tonight. But enjoy the community that you guys have here. And what you're going to see tonight is the celebration tonight is about that community and the agency in which you guys have had in it, and really enjoy that part. There aren't many times in your life you go through this that you really should just sit back and say, is really cool what we have here and who I am within this, and always be part of it. And so make sure that you really enjoy this part. So thank you for having me here. It's great that you allowed me to be part of your community to celebrate this part.
John, thank